Hi guys, it's Doctor Christopher Wellwood with the Regenerative Medicine Institute. I thought I might go ahead and give you a brief update of some of the interesting cases that I saw today. So if you're interested in shoulder pain or elbow pain or plantar fascial pain, definitely stay tuned. One of the first cases that I saw today is not an uncommon condition. However, it is uncommon for people to think that it's something that I can help you with. And that would be elbow pain. So this young lady came in today. She actually had elbow pain and both sides. So obviously she was having some discomfort. And after the assessment and exam, I actually determined that it was due to some issues, chronic, long-standing, almost 18 years worth of pain due to a couple of muscles that attach right here. One of them was the extensor digitorum, and the other one was the extensor carpi ulnaris. Now, for those of you who aren't in the medical field, those are the ones that actually do this with the fingers. So, and they do this too, this and this, kind of like a reverse wave. So, but she had this on both sides. So, what might have been thought of as tennis elbow, which is a little bit different, is actually scar tissue and adhesions due to long-standing typing, as well as mouse activity, which is causing her elbow pain. So anyways, what exactly did I do to it? Well, I did some prolozone on it today. So again, prolozone reduces inflammation, and a lot of her pain was actually due to inflammation. So luckily for her, the condition should be about 85% better within a couple of injections, and she shouldn't have that pain anymore. Another thing that we did was a condition called plantar fasciitis. Yes, the plantar fasciitis that a lot of people have, whether it's due to problems with golfing, basketball, hunting, walking, riding, it doesn't really matter. If you use your feet, you probably have at least heard about this condition because I think there's commercials everywhere for it. So what exactly is plantar fasciitis? Well, if my hand was the bottom of your foot, see, then the plantar fascia is the part that attaches to your heel. And if you have pain in the morning or anytime you get up or anytime you sit for a long period of time and you get the shoots sharp pain up here or is around the heel itself, then you might actually have plantar fasciitis. So what is it that we can do for plantar fasciitis? Well, when I was doing some research as a research specialist at the Center for Health Research in Portland, Oregon with Kaiser Permanente, we had an in-service there. And the in-service was actually on plantar fascia. So one of the things that I've always done as a provider is to teach people how to stretch their calves. So about 65% of all plantar fasciitis actually comes from calf pain. Why? Well, if this is your calf and this is your heel, pulling on it does this. So stretching it out makes it get better. I know it's really bad, but you'll have to deal with it. So as a prolozone specialist, what exactly did I do? Well, I actually examined her calves thoroughly. I wanted to see if there was any adhesions, if there was any inflammation, if there was any muscle spasticity, if there's any scar tissue that might have actually occurred. And I wanted to trace those down and actually saw to see if they actually were reproducing some of the plantar fascial pain. Luckily, with her, it was. I saw the same lady last week, and we had done the very similar injections, a little bit different areas, but very similar injections to her calves for the plantar fascia, and she had about a 30% reduction in the plantar fascial pain for this past week. Now, to put that into perspective, that's 30% of the time. Every time you get up and start walking, you don't have pain. That's 3 out of the last 7 days that she hasn't had any pain at all in her plantar fascia. So pretty darn neat stuff. We also found that she actually had tenderness in her heels. and of course we injected those as well. We change up the ozone just a teeny bit and the ratio to the ozone from the vitamins just a little bit to have a little bit more anti-inflammation in there. One of the other cases that we had today was shoulder pain. This gentleman has been a long-standing patient of mine for other issues, but then he comes in today and he says he has shoulder pain. So when I did the examination, his range of motion is completely normal, his strength is totally normal, but then he tells me that he's always had these kind of low-grade aches and pains right through this area in here, right to this area in here. His range is fantastic. So what exactly is wrong with it? Well, sometimes people who are in construction or painting or auto mechanics, chiropractors, any type of physician or provider who's using their shoulders might just have this long-standing low-grade aches that might be going on, whether that's due to tendonitis or bursitis. His is mainly due to bursitis. Bursitis is inflammation of a fluid-filled sac that is between two different areas. So if you have an area that's only this wide and it's got a little fluid-filled sac in it to provide lubrication in there, and that fluid-filled sac, instead of being this now, is like this or like this, you can see how it might cause some irritation when you're just moving it. So what we did for him is we did prolozone into the shoulder itself, and immediately he had reduction of pain. So just from that, we know that prolozone can help with bursitis, it can help with shoulder pain, it can help with tendonitis. We did a series of 3 injections on both sides. We did what's called superior, so we actually went right through here. We did anterior, so we went through the back side, and I did lateral up here as well. And of course, I did the acromioclavicular joint. That's where your collarbone actually attaches to your shoulder. Because there's a lot of arthritis, a lot of grinding in there. I want to make sure that we can start to repair and regenerate those tissues as much as possible. So those are the interesting cases that we had today, at least they're the ones I want to share with you that weren't the normal aches and pains of the back. But if you have any questions, any concerns, feel free to get a hold of me. I'm available at 509-299-6900 to talk anytime. Well, at least Monday through Friday anyway. Yours in health, Dr. Christopher Wellwood at Regenerative Medicine Institute.